if you're in like a normal conversation with a person like me who's like, okay, explain this to me because I've experienced alternative treatment and relief from it in a really wonderful way. Not into the woo-woo when it comes to like the feathers and the smoke and stuff. And I have done a ceremony. I needed to go through the experience, really enjoyed it, believe I truly did benefit from it. And it's something I'm following up on a medical level. However, how do you navigate that right now as someone who has been very evidence-based and very hardcore about it for very good reasons?
Yeah, and I read your transformative experience, and I'm happy for you. I think that's really awesome, and that's what I would say to other people as well. I think my concern is that
walk me through it like I'm on your chair, like I'm laying back in a thing. I'm going, Dr. John, explain this to me, please.
Well, I wouldn't do that in a therapy session, though. This is sort of what I'm doing on the outside. But I hear you. So all evidence-based health professionals like me want people to get the best treatments. I'm excited about psychedelic treatment. I'm excited about the prospect of cannabis treatment. What we want is it to be done right. We don't want the cart put before the horse. And so what that means is we want good science around it. The reason it's in the gray zone in my book, so to speak, is because it's just been plagued with bad science. There's small sample sizes, there's people dropping out, there's mixed results. And so what we want to see as evidence-based health professionals is just better science so that it can cross the somewhat arbitrary threshold from alternative medicine to evidence-based medicine. That's what we're rooting for, and we need better science to do that. The problem is that in the wellness world, you're going to get people that overpromise, overhype, overgeneralize, and again, play into that narrative and undermine evidence-based treatment. So it's
one of those identifiers you were talking about, right? As far as how you can tell the difference or delineate between real science and bullshit.
Exactly. They'll hype it up. And so good evidence-based practitioners will be honest and forthright about what we know and what we don't, what the risks are for treatments and what the benefits are. And, we'll be honest about we don't know everything about mental illness and mental disorders, and our treatments are limited. We know that. When you turn to a pseudoscience grifter or promoter, they'll say something like, mainstream medicine doesn't know anything. We have all the answers. Here's our treatments. Here's all of the science that backs it up. And it's all fake.
Us versus them. Us versus them. Yeah.
Us versus them. And that's the grift. And I think that's deceptive and exploitive for people.
What do you make of, from what you've read of, and I'm interested on a personal level, obviously, psilocybin for relief of depression? What have you read? What are your thoughts? Do you have any evolving kind of impressions or first strokes that you want to share with me? Because I'm fascinated by it.
Yeah, similarly, so it's one of those, it's not an unequivocal pseudoscientific treatment. So that warning sign that I said where it's divorced from the literature, that's not psilocybin. It actually could be plausible, and that's a good thing. So like I mentioned, I'm excited. I think it's a promising treatment. I'm just, based on the science that we have, it's not ready for prime time, so to speak, is kind of my concern. So, but that's not to say that it won't get there and that I don't want it to get there. We want that to happen. Again, it's just that the science has been plagued by, it's been bad. And so I'm grateful that, my own University of Calgary, I think there was a $3 million research fund to help study this stuff and its therapeutic potential. A neuroscientist, I think her name is Leah Mayo, is undertaking that. And, I'm excited for the bona fide research to come out so that it can be incorporated into clinical guidelines so that we can help people. The risk is that's why, evidence-based practice is part of our codes of ethics and our legal standards of practice, because if we jump the gun, so to speak, too much, it has the potential for harm, and we don't want to harm people as well. That's what we're saying here.
Yeah, I totally get it. I mean, it's currently one of those unregulated fun markets, right? A lot of people have, they'll get baked on shrooms and, go pubbing with their friends and have a bunch of laughs. But man, there are significant issues. I've watched people completely spaz out, people that have had, unrelated mental health issues that, are undiagnosed. You don't know what you're dealing with. You don't know how you interact with the fungi. You don't know how you interact with whatever strain it is, to your point, right? And I think, some of the people that I work with, and I'll kind of take you through. So I microdose. And I microdose with psilocybin, and I do it with a company that I trust. It was a result of the what I believe was a retreat for the weekend to understand the science, where I went and did a hero dose, as they say, of psilocybin. And I had this incredibly transformative experience, wrote about it. And I appreciate you reading it. And it's an exploration, but it's an exploration that I'm doing with the advice of my psychiatrist, with the advice of my doctor. And it's cross-referencing all the time. I'm asking questions. I'm trying to get to know the science. I'm trying to get to know about neuroplasticity. I want my mind to work, and I want it to work and network as well as it has for my entire life. I want to be able to be present in the moment. And I've experienced these really cool transformative moments where it's not, and I think when a lot of people will ask me, what is it like? Well, explain it. Are you happy? And I'm like, well, generally I'm happy, but that's because I've done 2 years of AA. I've done 5-6 years of CBT. I'm real close to my psychiatrist and my psychologist. And so I have better tools to manage my life and stress. And so for me, this was like I want to optimize myself. I want to learn about what else I can do for myself. Does that make sense to you as a practicing psychologist, as a professor, as someone who understands the human mind, and someone who's a medical professional? Or is that something where you're like, no, alternative treatments, forget it, all of it, done?
No, I think you've done it in the right way possible. I think if it were to be, that's respecting patient autonomy. What do we say? I mean, people are free to do that. And I think that the best way to approach these things is to do it as part of an evidence-based treatment team, like you said, in the context of psychologists, psychiatrists. And, it's not just people going and doing shrooms and kind of self-medicating. You're doing it in a very thoughtful, intentional way, knowing that you have a care team who knows your background. They've done proper mental health assessments. They kind of know what your potential risks and benefits could be. I think that's the optimal, ideal kind of way to do it. And so I'm happy for that. And I've heard great stories. So again, that makes me really optimistic about it because, like I said, all of our evidence-based treatments are imperfect. They don't work for everyone. And so we want to have better treatments. We want to have a better arsenal of evidence-based treatments. Again, we just want it to be done right.
Yeah.
I'm hopeful and optimistic that will become a thing. But again,
I thought you would give me a little evidence-based slap across the face here today. I'm really happy. You're like, no, good for you. You're doing it right. You're consulting. You're doing all the stuff.
And you said you put in a lot of other work too. You had a lot of psychotherapy, CBT is great stuff. You said AA, which I'll kind of return to as well, because I did put that in the gray zone, but I recommend to all of my patients, I help people with addiction, that they do seek peer support services, whether it's 12-step programs like AA. There's other peer support services like Smart Recovery, which is kind of CBT based. All of that is kind of great. AA, the reason I put it in the gray zone is because it's such an umbrella term. Like AA can work amazingly well for some people, and for some people it can hurt them just in certain ways. And usually it tends to be some of the folks who have something like an opioid use disorder, which is like heroin or fentanyl or something like that, where one of our first line treatments are what we call opioid agonist therapies. So they'll take things like methadone or Suboxone, which are actually medications. But when you get, some people are so militant in AA that they can become against medications, and so that can hurt someone. And so that's why it's kind of gray. There's a lot of benefits.
There's a lot of God in AA too, right? Yeah. There's a lot of like, hey, don't worry, just give it to him. He'll take it away. And I'm like, I grew up with that. Yeah. That doesn't work.
Some people don't resonate, with that spiritual component. And
I didn't.
But the research finds that, the power of AA really lies in the power of the group and
community. Yeah. Yeah. Well, you know what it was for me, you talk about it quite a bit in your practice. I've heard you talk about it quite a bit in podcasts. I listened to a couple of them over the past couple of days just prepping for this. And it's all of it, right? It's not one specific thing, but more importantly, the all of it that really stuck with me was community, right? It's interaction, it's engagement, it's positive experiences with people that have figured out how to respond well to that dilemma in their life, and you're coming along with them for that ride. And you might pick out different things. I'm a big believer in AA. I really am, for people, in as much as it's like an interdictive, if that's a word, treatment for people who it's almost like, when you go there, it's you conducting your own intervention. That's like last line of defense prior to rehab, prior to someone else and their family coming around you in a room saying, hey, you need to go, We need to, because we can't live with you like this. That's AA to me was like you saying, I need to go. I need to figure this out. I need to humble myself. But there are psychological triggers in AA where I'm like, that's not good for anybody. That's not good for anybody. And of course, the God element, which, I just never resonated with me because I always found everything like that to be woo-woo. Again, it's not evidence-based. Nothing in religion is really evidence-based at all.
Right. Yeah, so every single one of my patients that come through our clinic, I always recommend peer support services. And I tell them, like, there's AA, which is 12 steps. There's, again, Smart Recovery, which is CBT based. There's something called Dharma Recovery, which is more Buddhist kind of mindfulness based. I tell them, I don't care which support service you seek. Like, go whichever one resonates with you. Do you like the Buddhist mindfulness stuff? Do you like the CBT stuff? Or do you like the 12-step philosophy? Because I want you to get that power of community and the power of the group. And that's what we kind of encourage. It's that group. And so like I said, some people will resonate with different aspects of it. You get hardcore 12-steppers, as they say, hardcore AA people, and it's worked wonders for them. And I'm so happy for those folks. But then and at the same time, I get people that it makes them feel worse. So I said, well, let's try something different.